And in light of the new cases, Governor Kate Brown declared a state of emergency. That just means more people and more resources can be devoted to stopping the spread of the virus. Lindsay Nadrich joins us now with what we learned today. Lindsay.
Yeah, well, before we get into the number of cases and where they are, keep in mind that most people who get COVID-19 will only have minor symptoms similar to a cold. So today, health officials focused on protecting people who are likely to develop more severe symptoms. The most at risk are older adults and people with underlying medical conditions. At a press conference Sunday morning, state health officials announced 7 new cases of COVID-19 in Oregon, which brings the total number of cases in the state to 14. It prompted Governor Kate Brown to declare a state of emergency.
This emergency declaration gives the Oregon Health Authority and the Office of Emergency Management all the resources at our state's disposal to stem the spread of this disease.
Some of those resources include using emergency volunteer healthcare professionals, expanding telemedicine to screen people, and expanding testing. Of the 7 new cases, 3 people were already in the hospital when they were diagnosed. The other 4 are recovering at home and only have mild symptoms. As for where the new cases are, one is in Douglas County. We're told that person is medically stable. One is in Marion County, and 5 are in Washington County.
4 of the 5 new cases in Washington County are related to contacts of previous identified cases.
None of the new cases are related to travel. Most people who get COVID-19 will only have minor symptoms, similar to the common cold.
What we do know is that most people who get COVID-19 are going to experience mild symptoms. We know from data collected nationally and internationally that most people who contact COVID-19 experience symptoms similar to the common cold, a cough, a runny nose.
The people most at risk are older adults and people with underlying medical conditions.
COVID-19 can present as a mild illness. We want people to take this seriously and take measures to protect those that are most vulnerable. So we ask you, if you have any illness symptoms, please do not visit people in hospitals. Please do not visit your loved ones in long-term care facilities.
And if you're in that high-risk group,
Older populations, those with chronic medical conditions, we're recommending to stay out of large public areas, stay away from people who have symptoms, and to take care at home when you can.
All right, so in the next hour, we're expected to hear from the superintendent of the Hillsborough School District to talk about the student there that was diagnosed with COVID-19. We'll bring you updates as we get more information. Otherwise, though, the Oregon Health Authority does not recommend closing schools or college campuses right now where there are no cases of COVID-19. And again, if you feel sick and wouldn't normally go to the doctor, health officials say to stay home until you feel better for at least 24 hours. Brittany.